okay, I'm limiting myself to just complementary therapies, acupuncture, herbs, nutrition, chiropractic, some homeopathy, things like that, and I'll see if I can make a living. Because, again, that field, that did not exist. And before I knew it, I was so busy, and this is 15 years before the Chi Institute and things like that.
Right.
And before human acupuncture schools existed or anything. And next thing I knew, I was so busy, I had to hire another veterinarian that had done an internship with me, and then another and another, and it became the largest holistic integrative veterinary practice, referral practice, that no one that anyone knew of, because and it was both equine and small animal, and I did it just referrals only. But then what happened was a lot of the clients started seeing how the animals were doing even better than with conventional medicine, and then they just wanted me to come to the barn, or to the clinic, and I ended up, I couldn't take on any more horse barns because I was so busy, and that's when I kept on hiring other associates. And on the small animal, I couldn't take on any more, so I took on more associates. And then at that point, my reputation was spreading, and I got asked to be a professor. I was an assistant clinical professor at Colorado State Veterinary School, as well as at Tufts Veterinary School. And I edited the first textbook on veterinary acupuncture, as well as the first textbook on complementary and alternative veterinary medicine, on all of those. And then I started to burn out from that.
Yeah, well, that's the trouble when you're a pioneer in a field. You have to really push your way forward. You have to do the books, you have to do the courses, and you have to get people interested, and you still have to practice. It's a lot.
Exactly, and then I was getting asked to teach all over the world, so every 2 weeks I was teaching on the weekends somewhere and seeing patients all during the week. And, in the textbooks, they were the first, I knew that, okay, for a field to get accepted, there needs to be a textbook. And so my textbooks were the first ones introducing all of this as new fields. And yeah, it just kept on growing and blossoming from there. And then the American Veterinary Medical Association asked me to be on this committee to develop guidelines for alternative and complementary veterinary medicine. And then I was actually invited to be an endowed faculty full-time at Colorado Veterinary School, but I just couldn't do anymore, And, sometimes I question whether I should have taken that full-time position, but, again, I was doing everything everywhere, and, with the book, my first book for the public, Love, Miracles, and Animal Healing, I asked Bernie Siegel if I could do that, and he said, yeah, and that became, a top bestseller. And, so my goal with that was to educate clients that there was a whole new way of veterinary medicine, of natural healing that could be done, but not putting down Western medicine, And then my book, Kindred Spirits, How the Remarkable Bond Between Humans and Animals Can Change the Way We Live, that became, in 2001, it was rated one of the most spiritual books by Spirituality and Health magazine, where I was talking about the scientific basis of the human-animal bond based on all my stories from all my clients and the animals, and how animals can help change people's lives and vice versa.
So what have you seen in your years of practice that are the benefits of Chinese medicine and acupuncture and chiropractic for animals? What have you been able to treat that with conventional medicine you would have been just wringing your hands with frustration?
Oh, there's so much. Essentially my philosophy is no one form of medicine has all the answers. And if we're going to be doing the best that we can do to help animals heal, it seems like it would be wise to have the greatest variety of approaches to help. And so, a large part of my clientele and patient load at first was mostly musculoskeletal arthritic dogs and cats, hip dysplasia, back problems, paralysis, neurologic conditions that, again, didn't respond to conventional medicine, lots of gastrointestinal conditions, gastritis, equine colic that was not surgical, things like that. We were able to help. Essentially, it helps normalize gastrointestinal motility. So whether it's constipation or diarrhea, you can help with that. It helps balance the immune system. It helps relieve inflammation and pain associated with any type of arthritis. It helps stimulate microcirculation, increasing circulation, and it helps stimulate nerves. And that's why in certain issues with chronic back problems or paralysis, depending upon how severe it is, you can help bring the animals back. And some of the first cases that I ever did at the Animal Medical Center, those were the ones that made the skeptical veterinarians there open-minded, saying, oh my gosh, we recommended euthanasia, and now we referred it to Alan, and the animal's walking or running and living a good life. And we need to be more open to this.
Well, and if you can save an animal's life with alternative medicine or extend their life, that sure is something to be happy about. It's time for us to take a break and hear from our sponsors, but we'll be right back in a few minutes with more of our show.
Interested in learning more? Visit physical therapist Sally Morgan's website at sallymorganpt.com, where you will find details about her upcoming speaking engagements, craniosacral therapy, and Tellington TTouch offerings, as well as information about holistic care for animals. Join the mailing list today and be the first to learn about upcoming events and special offers. Sally Morgan is a best-selling author, and her book, Dances of the Heart, Connecting with Animals, details her journey of learning to listen to animals. Her unique set of animal connection cards offers 52 activities to enhance your relationships with the animals in your life, and she suggests that you ask your pet to choose a card each week. Both Sally's book and her cards are available on Amazon and her website, sallymorganpt.com. Join Sally Morgan PT CST Daily on Facebook for conversations with a corgi, and visit YouTube for past episodes as well as Sally's TED Talk. When it comes to our pets' health, you can never be too careful. We invest significant time in ensuring that they have long and happy lives, but it's important to invest the same dedication into our own longevity. The key active ingredient in Dr. Morgan's wellness formula, pure New Zealand deer antler velvet, is now available as a standalone human-grade product. Life Deer Antler Velvet is a whole food supplement rich in calcium and collagen to support healthy joints and strong bones. Our products prioritize purity, ethical harvesting, and quality sourcing above all else. Visit lifepurerecovery.com to learn more and order your first bottle today.
Tune into world-renowned author, speaker, and holistic veterinarian Dr. Judy Morgan, and now radio host of Dr. Judy Morgan's Naturally Healthy Pets on syndicated Dream Vision 7 radio network every Monday and Tuesday, 7 a.m. and 7 p.m. Eastern Time. Not sure which vaccinations should be given or how often? Not sure which food is best for your individual pet? Find out the answers to your questions in this weekly show where Dr. Judy interviews top experts and showcases the latest products that will help your pets stay naturally healthy.
Does your dog have bad breath? Tired of spending money on expensive dental procedures? Try out Dr. Morgan's Dental Drops today and save money while maintaining your pet's oral health. With New Zealand deer antler velvet as the primary ingredient, Dr. Morgan's Dental Drops are effective for treating stomatitis, gingivitis, and ulcers. You can purchase Dr. Morgan's Dental Drops directly from Amazon Prime or from her website, www.drjudymorgan.com.
This is Dream Vision 7 Radio Network, uniting mankind with universal love. Our shows are created from the heart, bringing each listener to a place of divine enlightenment. Breathe, relax, and enjoy. Let life flow.
Hello and welcome back. You're listening to Dr. Judy Morgan's Naturally Healthy Pets on DreamVision7Radio.com, and I'm your host, holistic physical therapist for pets and people, and Dr. Judy's sister, Sally Morgan, and I'm here with my guest, Dr. Alan Schoen. Alan, before the break, we were talking about the early developments in the fields of holistic medicine for animals, and I'd like you to tell me a little bit more about how you handled those skeptical veterinarians and indeed the skeptical clients as well.
Yeah, well, it was so interesting back then because, again, I was just very naive and idealistic and said, hey, these animals are improving. Why wouldn't we look at it? But many of the veterinarians, there were 80 veterinarians at the Animal Medical Center, they would just ignore me and look away or this or that. And then after I gave them a number of lectures, the head of Animal Medical Center said, okay, well, let's do a study. And what we'll do is, once we recommend euthanasia, that there's nothing more that the best animal hospital in the world could do with medicine or surgery, we'll refer them to you. And I naively, I said, oh, sure, just as long as I only accept the ones that I think I can help, and they went, yeah, okay, well, let's do that. So I thought, boy, that's a great control, okay, because, one of the criticisms about lots of complementary therapies is we're the control groups. You're not doing double blind, you're not doing this and that.
Right.
So having it that, okay, they're all recommended for euthanasia, there's nothing more, and then you do acupuncture, and at that point, that's all I was doing was just acupuncture. It was 1982. And they get better, you say, okay, you need to look at this, So one by one, the different veterinarians and the specialists at Animal Medical Center and internal medicine and surgery were saying, well, okay, we're recommending euthanasia for this animal, but if you want, there's this vet here who's doing acupuncture. We don't know if it would help, but we can send you over there, And the ones that I thought that I couldn't help, I wouldn't, take on. But if I thought that there was a scientific basis for helping an animal, then I would say, okay, and I'd explain it to the clients. And the clients, most of them were quite open. Simply, the ones that weren't open wouldn't come, but the ones that were open because they wanted to give their animals a chance and they loved them so much. So it ended up, when I published on it, 78% of the animals that had been previously recommended for euthanasia improved dramatically, greater than 70% improvement. And that
I can't argue with that statistic.
Yeah, and that was with, so they were able to live longer, happier, healthier, quality lives without pain and suffering. So then what happened, the word spread, and I was blessed with a very educated New York clientele that just the word spread, and before I knew it, I was so busy there, and like I said, and then I ended up selling my conventional animal hospital to focus just on all of this. And then once I added the chiropractic, then they improved even faster when I started incorporating Chinese herbs. And back then there was no Qi Institute, no courses in Chinese herbs for veterinary medicine. It didn't exist, right? So I went to Columbia Medical School, the human medical school, and they were giving the first training on Chinese medicine, Chinese herbal medicine for doctors. And again, I called up and I said, hey, I'm a veterinarian, could I come? And they went, sure, because again, there was such a small group of us. And so I took my Chinese herbal training for humans at Columbia Medical School and had to extrapolate over to the animals and figure it all out. There was no pre-organized courses or anything on that.
Well, it's so, Linda Tellington talks about being in that Feldenkrais class and within minutes saying, oh my gosh, I have to use this with animals. And here I was in my first craniosacral class for humans thinking, oh my God, this can change the lives of horses and dogs. And here you are sitting there with the Chinese herbs knowing the difference this can make. And it's such a lot of creative thinking, really, to transfer it from one species to the other, I think.
Oh, yeah. Now it's so easy for veterinarians because there are a number of different training programs in both acupuncture and herbs, and it's like, oh, you just take the training and you can do it. But when I started, I was like nothing existed, and but when you started seeing one animal after another, and I always joke with my clients, I said, I don't do anything that hasn't been proven on people first, and I said, okay, it's working